Welcome to the Air National Guard Self-Aid and Buddy Care course. During this course, we will examine various protective measures taken in extreme environmental conditions, and we will also cover treatments during emergency medical situations. We will discuss evaluation, treatment, and patient transportation methods. Self-Aid Buddy Care provides basic first aid training to preserve life, limb, and eyesight in a deployed environment or during an emergency at the home unit. This training may prevent long-term disabilities and enable wounded casualties to survive until additional medical care is provided. Everyone must be familiar with the contents of the individual first aid kit and where those contents are located within the IFAC. Failure to do this may place your life and the life of your wingman in jeopardy. Take the time now to become familiar with the IFAC before you need to actually use it. In the kit, you can identify the minor module, which has items that could be used in a variety of ways. In the trauma module, you will find there are 2 emergency bandages, also referred to as Israeli bandages. These bandages can be applied to open wounds. The proper application will provide protection to the affected area, absorb blood, and apply direct pressure. Other items in the trauma module include compressed gauze, a roll of surgical adhesive tape, and a nasopharyngeal, commonly referred to as an MPA, which is a tool we can all use to secure and maintain an airway in an emergency situation. There are additional items placed in the kit. The combat application tourniquets are also known as CATs. They are used in situations to stop bleeding when direct pressure is not adequate. Quick clot combat gauze is saturated with an agent that will aid in stopping bleeding where application of a tourniquet is not practical. Your kit also has a Ceralite packet, which can be used for rehydration. The key to Self-Aid Buddy Care is improvising. When you don't have the equipment you need, in a life-saving situation, you can use the casualty's gear or items found around you. For example, you can use shirts, towels, sheets, and socks for bandages. Belts and ties can be used as tourniquets, and sticks or tree limbs can be used as splints. Airway management is a top priority when performing Self-Aid Buddy Care. To simplify this statement, if the casualty does not have an open, patent, and self-maintained airway, then there is no breathing and death will occur. You as an airman have the ability and tools to open the casualty's airway and possibly save a life. If you determine that the airway is not open, there are 3 methods that can be used to open the airway. The first is the head tilt chin lift method. This maneuver straightens the windpipe to allow air movement in and out of the lungs. Ensure that you do not apply too much pressure, as this will cause the mouth to close. If needed, you can use your thumb to depress the victim's lower lip to keep the mouth open. The second method is the jaw thrust and is used to open the airway of a casualty with a suspected head, neck, or spinal injury. This technique is used to minimize movement of the head and neck to prevent further injury. Keep in mind that you may need to depress the casualty's lower lip to keep the mouth open. But remember, do not tilt or rotate the head. If you suspect head, neck, or spinal injury, immobilize the casualty by any means possible using items such as a C-collar, rolled towels, or other improvised equipment. The third method is the nasopharyngeal airway, also known as the MPA. This method can be used to establish or open an airway for a conscious or unconscious patient. When cutting the MPA, you must ensure to create a bevel. Don't use petroleum-based or non-water-based lubricants because these could cause damage to tissue and increase risks of infection. And remember to never force the MPA. If you encounter resistance, pull the MPA out and attempt on the other nostril. If you suspect a spinal injury, you should immobilize the casualty's head. Shock is the body's reaction to decreased blood flow to one or more organs of the body. The most common cause for shock is from blood loss and the resulting insufficient blood flow throughout the body. You may not see all of the signs and symptoms of shock immediately, but early recognition and treatment is critical to recovery. This is why you must treat for shock. Failure to treat for shock could result in irreversible damage or even death. The casualty must be kept warm and dry to prevent additional medical injury and to prevent shock from progressing. If the casualty is on the ground, be sure to put a barrier between the patient and the ground. And finally, do not allow the casualty to eat any food. Allow them to only take small sips of water. Once you have ensured the patient's airway is secure, it is critical that you address the circulatory system. This step can easily be accomplished while you are assessing the patient's airway. While you're observing for chest rise and fall and feeling for breathing, you can assess for a pulse. The next step is to check for bleeding, and if there is any, stop it. There are two types of bleeding, internal and external. Internal bleeding is not obvious and is a medical emergency. Do not delay advanced care. To control the bleeding, apply direct pressure first. If the nature of the wound allows, you should also elevate the area while applying direct pressure. One of the tools we have in our individual first aid kit is the emergency bandage. If after 3 minutes of continuous pressure being applied, the bleeding is not under control, apply the combat application tourniquet. Remember, once the tourniquet is placed and bleeding has been controlled, do not loosen or remove it. In applications where the tourniquet is not practical or feasible, for example, wounds to the groin, armpit, and chest, use of the quick clot combat gauze is appropriate. It works by slowing bleeding, causing the blood to clot in the wound. It is not absorbed into the body and does not produce heat. Therefore, it is safe to leave in the wound until reaching additional medical care. An open or sucking chest wound is a potentially life-threatening injury that can easily be treated in the field. This is accomplished by placing a non-occlusive dressing, such as a piece of plastic or an ID card over the wound and taping it on all four sides. Fractures are divided into two classifications, closed and open, often called compound fractures. The treatment for any fracture is the same. It is imperative to immobilize the affected area to prevent further damage to muscle, blood vessels, or nerves. The splint should include the joint above and below the involved area. Anything rigid can be used as an improvised splint. Patients' other body parts also work as a good splint. To treat injuries to the eye, you must cover the injured and unaffected eye to prevent further injury, as our eyes do not move independently. This brings us to another point, impaled objects. Never remove an impaled object from any part of the body. Doing so could cause further damage or lead to increased blood loss. Instead, stabilize the object and pat around the area. If you suspect a spinal cord injury, it is imperative that you immobilize the head and neck. This can be done in a variety of ways, but one example is using rolled towels placed on both sides of the patient's head and securing them with the tape provided in your IFAC kit. An evisceration is an injury best described as internal organs, primarily intestines, protruding from the body. Treatment for this is to apply a clean, moist dressing over the exposed area. Never push what is outside the body back in. This situation is a medical emergency and treatment cannot be delayed. Although there are 3 types of burns, the treatment for any burn is the same. You must first remove the patient from the environment that caused the burn and cover the affected area with a clean, dry dressing. Remember, ensure the scene is safe before putting yourself in danger to help your wingman. Airmen serve in a variety of extreme conditions, from the heat of Afghanistan to the cold of Alaska. Exposure to these extreme hot and cold environments can cause additional stresses to the body. You must have the ability to identify these stresses and how to properly treat yourself and your buddy. Heat-related injuries can progress quickly. Your ability to recognize early signs and symptoms, plus taking prompt action, may prevent further injury. In severe heat, a person can lose up to a quart of water each hour. Heat, activity, and acclimation will determine fluid replacement therapy. If fluid is not replaced, dehydration will set in. To treat for dehydration, remove the casualty from the environment if possible and place in a cool, shaded area. Loosen and/or remove clothing. Provide sips of water, remembering not to allow the person to consume large quantities of water. You can also provide them with Cerolite. Cool the casualty by sprinkling with water or fanning, but stop if the casualty starts to shiver. And most importantly, if symptoms do not improve or if they worsen, seek immediate medical assistance. Heat stroke can happen to anyone, even to those individuals who are young, active, and healthy. You must seek immediate medical assistance and transport. Remove the casualty from the environment if possible, place in a cool shaded area, and loosen and/or remove clothing. Cool the casualty by applying cold packs to neck, groin, and armpits. If no cold packs are available, flush with water and fan. Continue cooling until the transport arrives and monitor the ABCs. If shivering starts, then stop the cooling process. Remember, if at any time airmen are involved in a strenuous activity in a hot environment and display any of the signs and symptoms, request immediate medical assistance. An abnormally cold body temperature is a medical emergency. Individuals exposed to low temperatures for long periods of time suffer harmful effects such as hypothermia and frostbite. In the event of hypothermia or frostbite, seek medical assistance immediately. Remove the casualty from the environment if possible and remove any wet clothing. Try to warm the affected area by dressing the casualty in warm, dry clothing or placing a blanket under and over the casualty. Remember, do not rub the body parts. You can provide sips of warm fluids with no large volumes of fluid or alcohol. You should also keep up warming methods until medical assistance arrives. Monitor your ABCs and be prepared to perform basic life-saving steps. This training will focus on nerve agents because nerve agents are the most lethal of all the agents. Nerve agents affect the nervous system and they come in a vapor, solid, or liquid form. One important thing to remember about treating for nerve agents is that the antidotes may be effective even if given to a person with severe symptoms, as long as the victim continues to breathe. Now, let's take a look at how to use the nerve agent antidotes. Prior to deployment to risk areas, you will be issued 3 antidote treatment nerve agent auto-injectors or ATNAs, plus 1 convulsant antidote nerve agent or CANA to be used against nerve agents only. Upon notification of chemical attack and experiencing any of the nerve agent symptoms, you must put on your protective mask and self-administer 1 ATNA as follows. The first step is to remove 1 ATNA and remove the safety cap. Step 2, position the injector against the injection site and administer 1 ATNA by applying firm, even pressure until needle is triggered. Step 3, hold the injector firmly in place for 10 seconds. And step 4, carefully remove injector and bend the needle. Attach the used injector to the front or sleeve pocket of your outermost upper body piece of IPE. It is important to note that if within 5 to 10 minutes after administration of the first ATNA, your heart beats very quickly and your mouth becomes very dry, do not inject a second ATNA. Traumatic brain injuries are injuries that commonly occur among military members who have been involved in combat operations. A casualty may have a TBI if they suffer physical damage to the head, altered level of consciousness, and/or amnesia. Symptoms of a TBI are often different for each individual. Some casualties may experience all of the symptoms listed, while others may only display one of them. TBI injuries are difficult to treat by non-medical personnel. While waiting for medical assistance, treat any visible wounds and talk to the casualty. Assume the point of contact and treat for shock. Make sure that you document as much as possible on the incident and nature of the injuries on the casualty care card. One other factor to consider based on the patient condition is the 9-line medevac card. Gather as much information while waiting for medical assistance because this may be critical in the treatment of the casualty. Although recognizing the signs or symptoms and treating a TBI can be difficult, you need to seek medical attention for your buddy. Failure to do so can potentially create a life-threatening situation. Stress is the body and mind's process for dealing with uncertain change and danger. There's a laundry list of things that can cause stress, and some may be more stressful to some than others. Stress conditions can be actual or perceived, and it can be altered from situation to situation. Know the members of your team and be on the lookout for signs of stress. If you see a change in your buddy's behavior, explain to them that there are trained professionals available to help them. Help can come from the mental health office, chaplain, first sergeant, supervisor, friends, and family. If you suspect or an individual expresses desire to harm themselves or others, immediately notify your chain of command. If over the phone, call 911 first, then notify command. PTS is a normal reaction by a normal person to an abnormal event. The operational environment of today's military exposes airmen and units to many unforeseen demands. The need to perform under these different situations can cause stress. Being a wingman is being a leader and a responsible friend or co-worker. When you identify a fellow wingman experiencing overwhelming stress that could have a negative impact on that individual, you need to take action. There are a few things to consider before attempting to transport a wingman. Is the area safe or is conflict still in process? Is your patient conscious or unconscious? And to what extent is he or she injured? Remember to look at how far you will have to carry the casualty and to what extent your physical condition will allow. You will also have to look at the terrain you will have to negotiate, such as bodies of water or other obstacles that may delay your efforts. When considering to move a patient, some key principles need to be kept in mind. Remember that if a patient has a suspected broken bone, that you splint and swath the injury and whenever possible, control bleeding before moving the casualty. When positioning a casualty for a move, always remember to maintain an open airway throughout the move. When preparing a casualty for transport, you must ensure that your patient is in the proper position for the movement. Based on the type of carry you're going to perform, a patient may be required to be on their back or in the standing position. Remember that you must use proper lifting techniques when moving a casualty. One-person carries are normally accomplished in a care under fire condition and are not intended to carry the casualty over a long distance or for long periods of time due to bearer fatigue and casualty safety. You should use a two-person carry whenever possible. This carry provides more comfort to the casualty and is less likely to aggravate any existing injuries. This will also be less tiring on the carriers. If possible, use a standard litter for patient transport. This will allow for safe movement over greater distances and is less likely to aggravate any existing injuries. In the event that a standard litter is not available, you may have to construct an improvised litter using whatever is available to you. In any event, a minimum of 2 litter straps must be used to secure the casualty. One thing to keep in mind is that if at all possible, the litter strap should be placed over the chest and mid-thigh, taking into consideration any patient injuries. This concludes your self-aid buddy care training.